Okay, good evening, everyone. This side, Dr. Abhijeet. Yes, yes, Mukesh, hello. Mangal, hello, hello. Yes, Osama, good evening. Sakshi, good evening. Shakil, good evening. Let us start, guys, today with a very new topic that is head and neck. Right, I will be starting with the head and neck today, and guys, the very first topic in skull that I will be covering are the bones. Are the bones. Pranay, good evening. Alisha, Samantha, Khan Sahib, Rushali, Kailash, welcome, guys. Today I will be starting with a very new topic, guys, and I assume, guys, ki we will start from the scratch. We'll start from the basics. I personally feel that if you don't know anything about head and neck, you are at the right place, guys. We will be starting with very basics. Kailash, okay. Mehboob Raza, good evening, beta. So yes, yes, bilkul. Obviously, Sachin, yes. I will be like going from base to like high elevated part. So obviously everyone can attend the session. So before starting with the session, Fateh, Raviraj, good evening. Just give me a thumbs up in the chat box that audio and visuals are perfectly fine. Just give me a thumbs up in the chat box that audio and visuals are perfectly fine so that I can start with the session. Guys, I am requesting everyone to write down the notes along with me, guys. Please write the notes along with me. Pranay, Shakti, Khan Sahib, Elijah. Okay. I'm speaking in English only, yaar. Shakil, Sachin, Venki, Samantha, Kailash. Okay. Yes, okay. FactTube Tamil, yes, you can attend. Osama, very good. Mukesh Chat, Namaskar. Yes, I will be associating it with every possible thing. We are going to discuss everything clinically, but let us start today with the basics, right? So guys, as you all know that Jay Prakash, Alisha, chalo, फटाफट से अब start करते हैं लिखना. Let us start with the skull, guys. Now, as you all know that the skull, it is the skeleton of the head. It is the skeleton of the head, right? You already know when we talk about the skull, it is the skeleton of the head. Alhadita, yes, yes, it is the skeleton of the head. Now, when we talk about the structure, guys, when we talk about the structure, remember that this skull, it is formed of how many bones, guys? Can anyone tell me how many bones are there in the skull? Can anyone tell me in the chat box how many bones are there in the skull? Chalo. Let it be an interactive session, guys. You are going to, yes. Hmm. Sure. You guys already know that it is formed of 22 bones. It is formed of 22 bones, right? It is formed of 22 bones. Yes. Mukesh, very good. Very good, Mukesh. Yes, Shakil, very good. Very good. कोई बात नहीं आता है. We will try to learn it from the scratch, guys, right? So you already know, out of these 22 bones, guys, out of these 22 bones, you already know we have one movable bone, one movable bone, and that is called as the mandible, right? That is called as the mandible, guys. That is called as the mandible. Yes, everyone is right. Everyone is right. And the others are basically 21 immovable bones. Immovable bones, right? Now, guys, let us just try to see first the mandible. Now, guys, this is the anterior view of the skull. If you can just see over here, guys, this is the anterior view of the skull. Anterior view of the skull, right? This is the anterior view of the skull. Now, you're watching the skull from front. You're watching the skull from front, and only bone which is like, yeah, which is movable, and that is the mandible, guys. I hope everyone can appreciate this is the mandible. This is the only movable bone over here, right? It is the only movable bone over here. I will be discussing all the aspects. FactTube Tamil, don't worry. So this is the mandible bone, and basically why it is movable, because it is actually forming a joint with the temporal bone. That is a synovial type of a joint. Okay, you already know the synovial joints are movable. Okay, so basically the mandible, it is forming a synovial joint with the temporal bone, right? It is forming a, yes, the synovial joint with a temporal bone, right? Now, guys, the 21 immovable bones, let us just try to classify it, guys. Let us just try to classify the 21 immovable bones. The 21 immovable bones. And you already know mandible articulates with which bone? Can anyone tell me? Mangal, yes. Good evening. Now, the mandible articulates with which bone? Now, before coming to that bone, guys, yeah, we are going to discuss all the bones which are paired. Out of 8, we have, 21, we have 8 paired bones. Factube Tamil, very good. Niku Chauhan, very good. Yes. Mangal watching from Afghanistan. Thank you for the love. Yes. Now we have the 8 paired bones. Guys, I'm telling you over here that I will be discussing each bone separately also. Today I will be discussing the different views of the skull. Okay, in different views, from front, from above, from behind. Okay, and later on I will be taking each bone separately also. Okay, I will be teaching you osteology also. Please don't skip the session. Okay, that is something I want from everyone over here. Please don't skip the session. This head and neck is a very tough topic, and I will make a piece of cake for you if you guys be with me throughout the lecture. Right? Khan Sahib watching from Pakistan. Thank you so much for the love. Yes. So now, guys, if this is the anterior view, you're watching the skull from front. Yes. Now, the very first bone that you can just see over here, guys, the topmost over here, it is called as the frontal bone. Okay, it is called as the frontal bone. Now, frontal bone, it is only one. Yes. Frontal bone, yes, it is only one over here. Yes. Mukesh, very good. Okay. Vrushali, okay. Yes, frontal bone, it is only one. So I will not characterize frontal bone in the 8 paired bones. We have, like, yes, the 5 unpaired bones. The 5 unpaired bones, and the bones in front, guys, it is the frontal bone. Okay, we have the frontal bone, and remember, it is only one. It is only one, guys. The frontal bone, it is only one. It is situated in the front. Right? Yes, I will teach muscles also. Don't worry. I'm taking this like long sessions. I will be completing each and everything. Even some muscles, I will tell you in the aspects also, Osama. Now, I hope, can anyone tell me which view is this? Can anyone tell me which view is this? चलो फटाफट से बताओ, which view is this? You're watching the skull from side. Side basically means, chalo, side basically means, yes guys, this is the lateral view. Yes. Factube Tamil, okay, the lateral aspect. You are actually watching it from the lateral aspect, right? So guys, just try to see. We have the bone that is called as frontal. Frontal. You can see the frontal bone. You can see the frontal bone over here. Apart from that, guys, you can also see the parietal bone. The parietal bone. Right? We have the parietal bone. Now, guys, how to remember that? Frontal is in front. Parietal is above. Have you seen Pari? Pari basically bears a crown on his, like, on the top. Okay, so that's why you can remember we have 2 parietal bones, guys. The right parietal bone and the left parietal bone. Right? In front we have the frontal. Parietal we have like 2. The right parietal bone and the left parietal bone. Right? Samantha, you can watch this from the side, guys. This is the side view. You're not watching the skull from front. It's the side view, right? So, yes. Frontal is this, guys, where, like, the anterior view is this, Samantha. Okay? Survivor, hello. So, guys, remember, in the 8 unpaired bones, first, you should remember we have, like, the paired bones. We have the parietal bones. The parietal bones. And remember, we have, like, 2 parietal bones, right? It is 2 in number. 2 in number. Yes, the right parietal bone and the left parietal bone. the right parietal bone and the left parietal bone, right? Now guys, now coming on to the next bone guys, just below the parietal bone, you can very well see this green colored bone. Yes, that is called as the temporal bone guys. This is called as the temporal bone. This green colored bone, this is called as the temporal bone guys. Okay, this green colored bone, it is called as the temporal bone. Right now guys, you can see one temporal bone over here. Okay, you can see this meatus guys. This is the external auditory meatus, right? Your ear meatus. Okay, the opening in the ear guys, the external auditory meatus, and just above this we have this temporal bone, the green colored bone, and it is again 2 in number guys. I hope you can appreciate this green color over here also in the anterior view. That is exactly the temporal bone. So we have 2 temporal bones guys. We have 2 temporal bones. We have 2 temporal bones. So again, the 2 temporal bones you have to remember, right? Temporal bones, and remember they are again 2 in number. The right temporal bone and the left temporal bone. The right temporal bone and the left temporal bone. Now, coming on to the next bone guys, you can very well appreciate this in the lateral aspect. This orange colored bone, that is called as the zygomatic bone. That is called as the zygomatic bone. Now you can see that the zygomatic bone, it is basically forming a joint with the temporal bone. Joint, or I can simply say the suture. The suture, right? Now this zygomatic bone, it is also forming a joint with the frontal bone. Okay, above with the frontal bone, and like laterally you can see it is the temporal bone, right? So these joints are nothing but the sutures guys. These are nothing but the sutures. So as of now, remember we have the zygomatic bone, and it is again 2 in number. One you can see on this side, other side also we have the zygomatic bone. If you want, you can just point at this structure. This is the zygomatic bone. Zygomatic bone. In the anterior view you can also see, and in the lateral view you can also see. So the third one guys, remember we have the zygomatic bone. Zygomatic bone. Zygomatic bones, that is again like 2 in number. Yes, the right and the left zygomatic bone. The right and the left zygomatic bone. Now guys, again coming on to the next bone guys. Now the bone which is behind guys, you already know this is anterior and this is the posterior part, right? This is anterior and this is the posterior part. Anteriorly we have the frontal bone. Posteriorly, this blue colored bone, it is called as occipital bone. It is called as occipital bone. Now, if you just want to see over here, guys, okay, let me just try to show you the posterior part. Yes. So I hope you can appreciate, guys. You are going to tell me which bones are these. Meanwhile, I am writing this. This is the occipital bone. This is the occipital bone. And remember guys, this is the posterior view. You're watching the skull. This is the posterior part of the skull, right? Yes. So Alicia has answered. Shukaut. Yes. Srini, very good. Yes. Yes. Osama, Samantha, very good. So this is the posterior view. You're watching the skull from behind, and this is nothing but the parietal bones. The 2 parietal bones, the right and the left. Jaya Prakash, Shakil, very good. Very good. Alicia, very good. Very good, beta. So you already know we have these, yes, the 2, I mean the 1 occipital bone. We have the 1 occipital bone. Occipital bone. Okay, the occipital bone. Now guys, coming on to the next one. Yes, coming on to the next one guys. You can very well see over here in the front, if I just try to mark this structure guys, this just below the frontal bone, we have these 2 nasal bones guys. If you can just see, we have these 2 nasal bones. This is nothing but the nasal bones, and again guys, it is a paired bone. The nasal bones are paired bones, right? the nasal bones are the paired bones. So remember, we have the nasal bones, and nasal bones are again 2 in number. Just exactly in the midline, we have the right nasal bone and the left nasal bone. The right nasal bone and the left nasal bone. I'm coming to that. Now guys, coming on to the next bone, just below this nasal bone guys, this bone, it is called as the maxilla. Maxilla. And maxilla, again you guys can see there are two maxilla guys. There are two maxilla. They are joined together with the help of a joint that is inter. Inter means in between the two. Maxillary suture. All the joints in the skull guys, they are sutures. Now all the joints in the skull, they are immovable. They are called as suture. In between these two bones, now let us suppose this is maxilla and this is another maxilla. In between guys, we have something that is called as the sutural ligament. Okay, we have the sutural ligament, and this is something which makes it immovable. This is something which makes it immovable guys, right? This is something which makes it immovable. So we have the sutural ligament, right? So remember that we have the two maxillary bones. Maxillary bones, and again guys, remember these are 2 in number. These are 2 in number, right? These are 2 in number. We have the right and the left maxillary bone. The right and the left maxillary bone. Now guys, coming on to the next one. Coming on to the next one guys. That is called as the lacrimal bone. That is called as the lacrimal bone, right? So we have something called as the lacrimal bone. Now guys, just try to see over here. In the lateral view, it will be more, okay. Guys, I hope you can appreciate. You guys are going to tell me which bone is this? Which bone is this? You guys are going to tell me which bone is this? What is A? What is B? And this third one, which I'm telling you right now, it is the lacrimal bone. It is the lacrimal bone. Yes. Yes, Osama Sheikh, very good. Jaya Prakash, Mukesh, very good. Very good. Very good, guys. Samantha, very good. हाँ, ठीक है, ठीक है, ठीक है. You already know it is the lacrimal bone. it is the Samantha. ठीक है, ठीक है. What about rest, guys? What about rest? A है nasal. Yes, A is the nasal one. Beta B, it is the maxillary. Maxillary is going like above. Yes, Rohit Kumar, very good. साक्षी नहीं बेटा, अभी वो नहीं आया है, वो नहीं आया है. B देखो, maxilla ऊपर ही तो जा रहा है. Maxilla, it is going above only, just behind the nasal part. Yes, B, it is the maxillary bone. B, it is the maxillary bone. B, it is the maxillary. Ankita, very good. Shakil, very good. Very good. And then just behind this maxillary, guys, in the orbit part, you can see this lacrimal bone. Again, makes a sense, guys. It's forming the part of the orbit, lacrimal glands, right? So that is something you have to like focus over here. Okay, beta. तो अगर ध्यान से भी देखोगे ना, if you just try to see from like, yeah, you can see this bone, guys. This is nothing but the maxilla only, right? This is nothing but the maxilla, right? And the front one, it is the nasal. So this is the maxilla, and the lacrimal is just behind this, right? I hope it is clear. I hope it is clear, guys. Just give me a thumbs up if it is clear. So we have the two lacrimal bones that are again 2 in number. That is right and left. Right and left. The two lacrimal bones. Yes, the right and the left one. Right? Now guys, coming on to the next bone. Yes, we have the 7th and the 8th one. I'm writing over here. We have something called as inferior nasal concha. Junaid, I will be uploading it on my Telegram channel, and the Telegram channel is Docsmayan. Okay, the Telegram channel is Docsmayan. Please, now don't ask me for the notes now. The inferior nasal concha. It is again beta 2 in number. That is right and left. The right and left. Now guys, if we talk about the inferior nasal concha, Now, the inferior nasal concha, you will be able to appreciate, guys, over here. Okay, I have included that image. Okay, let me just try to see it over here. Okay, now yes guys, this is the skull part. This is the skull part, guys. If you can just see over here, what I have done, I have removed like one section of the skull. I've cut the skull like this in middle. Okay, and I'm just trying to show you one side of the nasal cavity. I'm trying to show you one side of the nasal cavity. I've cut it from between. I'm like removed one part and I'm watching it from the side, and I will be able to see this green colored bone. That is called as the inferior nasal concha. Inferior nasal concha. Inferior nasal concha, right? Yes, inferior nasal concha. Now, now guys, just try to see. We have superior nasal concha and yeah, the middle nasal concha. We have three nasal concha, but you guys will ask me, ki, sir, why you have written again separately inferior nasal concha in your list? Why you haven't written superior nasal concha and middle nasal concha? Again, this is one of the questions of the NCI exam, guys. That superior nasal concha and middle nasal concha, they both are parts of ethmoid bone. So that's why they are not written separately. Ethmoid bone, yes, the ethmoid bone, guys, remember it is an unpaired bone. It is an unpaired bone, right? Yes, the ethmoid bone, it is an unpaired bone. And these both, the superior nasal concha and the middle nasal concha, it is basically the part of the ethmoid bone. Right? That's why guys, the question was asked. Again, you guys are going to answer me that question, which is not a part of the ethmoid bone, which is not a part of the ethmoid bone. Superior nasal concha, middle nasal concha, inferior nasal concha, or none of these. Sure. You just try to answer this question. Meanwhile, I have just showed you. And guys, remember we have these two. Okay, this is what I have done. I have like removed, I'm watching the skull, the inferior part of the skull, right? And guys, you can very well see the highlighted bone. These are called as palatine bones. These are called as palatine bones, and these are again two in number. These are called as, yes, FolkTube Tamil, Soni Gupta, Jaya Prakash, Shakshi Maske, very good. Yes, Shrini, very good. Alisha, very good. Very good. So we have these palatine bones, guys. These are again paired in number. Right? These are two in number. These are two in number. So remember, guys, the eighth one over here I am writing. Yes, the eighth one. Yes, you already know we have the palatine bones. Palatine bones. And remember, these are like two in number. The right and the left. The right and the left. The right and the left. Approx, I don't know. There will be like many lectures because I will be teaching everything, even the bones also, osteology also, muscles also, arteries, veins, nerves, cranial nerves, everything. So yes, it will take time, obviously. Yes, beta palate wala part ho gaya na, or oral cavity ka. We'll be discussing palatine bone also. No need to worry. As of now, just try to remember the names and just a basic picture that I'm showing you. I will be teaching each bone in detail, guys. No need to worry. Okay. Now, guys, coming on to the unpaired bones, we have already discussed the frontal and the occipital. Now, guys, we have more three unpaired bones. Yes, we have sphenoid bone. We have sphenoid bone, right? We have sphenoid bone. Okay, we have like ethmoid bone that we were just talking about, ethmoid bone. And we have one bone that is called as vomer. We have one bone that is called as vomer. Yes. Yes. Now let us just try to see over here, guys. Let us just try to see here. Now, guys, in the this Dr. Devesh, hello, beta. Now, in this lateral aspect, guys, if you can just appreciate this yellow colored bone, I hope you can appreciate this yellow colored bone. And this bone, guys, yes, this yellow colored bone, it is called as the sphenoid bone. It is called as the sphenoid bone. Now guys, you can watch this sphenoid bone from both the sides. Again, that doesn't mean that sphenoid bone is 2 in number. Sphenoid bone, it is only 1 in number. You can watch this yellow colored bone on from the right side also and from the left side also in the lateral aspect. But again guys, this is the only bone, I mean, which is like 1 in number. Now these are the greater wings. Now let me use another pen guys. This is the sphenoid bone. This is the sphenoid bone. You can watch this from this view also. You can watch this from here also. This now it doesn't mean they are 2 in number. It is only 1, and this is how the sphenoid bones look like. You can see the greater wings of sphenoid. The greater wings of sphenoid. Now these are the greater wings which you can see on this lateral aspect, guys. Which you can see on this lateral aspect. That is something guys you have to remember over here. The sphenoid bone, it is only 1 in number, right? These are the greater wings of the sphenoid which you can see on both the sides, right? Now coming on to, yes, the ethmoid bone, right? The ethmoid bone, if you just ask me over here, let me just try to show you guys over here. Yes, just behind the lacrimal bone, guys, this green colored bone, which you can just see over here. Yes, this small green color bone, this is called as the ethmoid bone. This is called as the ethmoid bone. Just behind the lacrimal bone, you guys can see this green colored bone. Yes, Dr. Dr. Ratnesh, very good, beta. This is the ethmoid bone, beta. This is the ethmoid bone, right? So ethmoid bone, if you just want to see, this is the ethmoid bone, guys, which you can see over here. The ethmoid bone, the anterior and the posterior views, right? So this is the ethmoid bone, which is 1, right? We are having 2 views from front and from the back. How does this look like, right? So that is something you again have to remember, the ethmoid bone, right? I'll be teaching ethmoid bone in detail. No need to worry. It's just behind this lacrimal bone. That is the ethmoid bone, right? Now coming on to yes. Yes. So I think everyone is like able to understand this, right? Now, guys, in the nasal cavity, in the midline, you can appreciate this one bone that is, yes, that is called as the vomer. That is called as the vomer, guys. That is called as the vomer. One bone in the midline, in the nasal aperture, you can just appreciate this bone that is called as the vomer bone. That is called as the vomer bone. So yes, this is again a one bone only. So we have like unpaired bones, right? So we have like 5 unpaired beta, 5 unpaired bones, and the 8 paired bones. 8 paired bones means 16, right? And 5 unpaired, 16 plus 5, that is 21 immovable bones because they are joined by sutures. They are joined by sutures, right? And one movable bone that is joined by the synovial joint, that is like the temporomandibular joint, okay? And that is the synovial joint. So I hope the basic, I mean, the orientation is clear, like what all bones basically comes in the head part. So just give me a thumbs up in the chat box, guys, that you are aware of all the bones that comes in the head part so that I can start with the different aspects of the skull. Sure. Just give me a thumbs up in the chat box if you are done with this. Chalo. FactTube Tamil, very good. Sakshi, very good. Very good, Peter. Let us now, yes. Alicia, very good. Chalo. Chalo, guys. We have now started with the skull part. We have discussed what bones are there. We'll be discussing each bones. To study each bone separately, guys, we'll come to it later on. But first, try to look at the aspects of the skull, right? First, try to look at the aspects of the skull. Yes, in different views, right? Now, put the heading as the parts of the skull. Yes. Alicia, Maria, Shakil, Ratnesh, Saad, very good, very good. Now put the heading as the parts of the skull. Now, the skull beta, it is divided into 2 parts, right? Now, We have the cranium. We have the cranium, right? In short, I will be writing out, right? I'm not going to make you write those thesis. Yes, I will be providing you, yes, with the notes. Sad, yes, I called your name. Yeah, we have the facial skeleton. We have the, yes, the facial skeleton. Now, cranium, you can just see guys, it is the uppermost part, right? Upper and the posterior part which encloses the brain. Okay, and facial skeleton, it is basically the anterior part of the skull, and it includes upper fixed part. It includes the upper fixed part, and we have the lower movable part. Yes, the lower movable part. Okay, the lower movable part. And can anyone tell me which is the movable bone in the entire this skull? Yes, I'm waiting for your answers, guys. Yes, just tell me about this. So that is again, you already know the parts of the skull. Yes, Abhishek Shah, very good, beta. It is the mandible. Very good, beta. Chalo. It is the mandible. The other ones are all having sutures. The other ones are all having sutures. Yes. Yes, Satyub, Sanjeev, Ahmad, Maria, Osama, Alisha, Ratnesh, Jaya, Mukesh, very good. Very good, guys. Ankita, very good. Very good. Sakshi, very good. Chal. Now, let us start with the different aspects of the skull. That is our topic for today, the different aspects of the skull. Now, guys, whenever you try to look the skull from front, guys, that is called as the anterior aspect. Anterior aspect, or it is called as Norma Frontalis, or it is called as Norma Frontalis. Whenever you try to look at the skull from front, you are watching the anterior part of the skull, and this is something called as the Norma Frontalis, guys. This is something called as the Norma Frontalis. The second one, guys, the second one, remember the superior aspect. The superior aspect, or it is also called as Norma Verticalis. The Norma Verticalis. Whenever you try to look the skull from above, guys, whenever you try to look the skull from above, it is Norma Verticalis, right? Norma Verticalis. The third one, guys, the third one, remember we have the lateral aspect, the lateral aspect, or it is called as Norma Lateralis. The Norma Lateralis. You're watching the skull from side, guys, right? You're watching the lateral part of the skull, right? That is called as the Norma Lateralis, right? Then we have the posterior aspect of the skull. The posterior aspect, or yes, the Norma Occipitalis. Now it is the view, guys, where you are watching the skull from behind, the posterior part of the skull, right? That is yeah, the Norma Occipitalis. Then again, Sakshi has told, yes, we have the inferior aspect of the skull. When you're watching you're taking out the skull and you're trying to see the inferior part of the skull, the inferior aspect, or it is called as Norma Bassalis. The Norma Bassalis. The Norma Bassalis, right? Yes, Osama, very good. Very good. Then, guys, remember, we have the interior of the skull. Interior of the skull, right? Or it is called as cranial cavity. Cranial cavity. Cranial cavity is that cavity in which we have our brain, right? In which we have our brain. So we are taking out the upper part and we are just watching the cranial cavity in which the brain is situated, right? So basically the cranial cavity is studied by the removal of the skull cap. Okay, we remove the skull cap and then we try to look inside what all is there, right? So that is the cranial cavity, guys. So these are the different aspects of the skull in which we have to like study. So is it clear, everyone? So I hope everyone is writing along with me. Just give me a thumbs up in the chat box, guys, if you are writing along with me. Just give me a thumbs up. So I will be starting with the very first one, that is the Norma Verticalis. The Norma Verticalis, right? The Norma Verticalis. चल सबसे पहला हम लोग तो स्टार्ट करेंगे गाइस. जस्ट ट्राई टू रिमेंबर. यस, फैक्ट्यूब, तमिल, ओसामा, अलीशा, जया, अभिषेक, मारिया, वेरी गुड. We are going to start with the Norma Verticalis first, the superior aspect or the Norma Verticalis, right? I hope you all are writing the notes along with me. Soni Kashyap, yes. I hope everyone is writing the notes along with me. Chal. Chal. Now guys, just try to see over here. We are going to start with the Norma Verticalis, and the first point that you have to write over here, that it is the upper aspect. It is called as the upper aspect, guys, or the vault of the skull. Vault of the skull. It is the upper aspect or the also called as the vault of the skull, right? Now guys, just try to see over here. Now this is how the skull looks when you view it from up, right? The superior part of the skull, right? So guys, remember that this is the frontal bone. Now which bones, guys, you can see over here? Frontal bones are how many in number? Yes. Frontal bones are how many in number? It is only one, right? We have the two parietal bones. Yes, Factube Tamil, very good. We have the two parietal bones. We have the two parietal bones. And over here you can see a little bit of the occipital bone as well. Occipital bone as well, right? So we have two parietal bones, one occipital, one frontal. Yes. Yes. So yes, let us just try to write this, guys. So the very first thing, under what headings we are going to discuss it? The bones which are forming it. So the bones forming it, it is like 4 in number. It is like 4 in number. And you guys already know which bones are there. Yes. We have the frontal bone. Frontal bone. Okay. We have two parietal bones. The two parietal bones. Yes. The two parietal bones. And the third one, guys, one occipital bone. One occipital bone. One occipital bone. Occipital bone, it is posteriorly located. पीछे की तरफ होता है, it is posteriorly. Frontal bone anteriorly, आगे की तरफ, and parietal bones on each side. On each side. So whatever we will see, we will try to just see over here as well, right? Whatever we will see, we'll try to write it over here. Now guys, how to say that, guys? This one is frontal. You can see it has a broader, broader anterior part, and guys, remember we have a narrower like posterior part. Narrower posterior part. This is how you recognize the Norma Verticalis. So this is the anterior part, guys, and yes, this is the posterior part, guys. So we have a broader frontal bone over here, right? With a very narrow, like the part over here, that is towards the occipital bone. That is towards the occipital bone. Now guys, coming on to the sutures bit. Coming on to the sutures, in joints we have like 3 classification. We have sutures, right, which are immovable. Then we have cartilaginous joints. Then we have synovial joints. So over here in the skull, we are going to talk about sutures only. Now guys, these sutures are nothing but, let us suppose this is a bone and this is another bone. Whenever two bones will meet, obviously a joint will be formed. And this joint, yes, it is like filled with a ligament that is called as sutural ligament. It is filled with a ligament that is called as a sutural ligament. And over here, we are going to see which sutures are present. Now guys, just try to see over here. Between the frontal and the parietal bone, guys, this suture, it is called as the coronal suture, guys. Okay, it is the coronal suture. It is the coronal suture. Now guys, I hope you remember we have discussed one plane over here that is called as the coronal plane. Again, makes a sense, guys. The coronal plane runs like this coronal suture only, which divides the body into anterior and posterior half. Now imagine guys, अगर मैं इसको यहाँ से कट करूंगा तो बॉडी को एक आगे वाले हिस्से में एंड पीछे वाले हिस्से में कन्वर्ट करेगी, राइट? इट विल ट्राई टू ब्रेक द बॉडी इनटू एंटीरियर पार्ट एंड पोस्टीरियर पार्ट. That is called as the coronal plane. That's why given the name coronal plane based on this coronal suture only. Okay, that is guys, please try to like see over here, right? So we have this coronal plane. It runs between the frontal bone and the two parietal bones, right? The two parietal bones, the right and the left. We have another suture between the two parietal bones, guys. Yes, and that again, it makes the sense. It is the sagittal suture, guys. It is the sagittal suture. It is the sagittal. You might have heard about mid-sagittal plane. Now, that sagittal basically means we are cutting the body from midline. Okay, and it divides the body into right part and left part. Again, this sagittal plane, basically it is named on the based on the suture only, guys. That is the sagittal suture, right? It is dividing the body into two parts, right? It's dividing the parietal bones also, like joining the parietal bones. Similarly, a cut, if it is like made like this, the mid sagittal plane, dividing the body into right and left part. So that is again, and the name of the joint is sagittal suture, guys, right? Now guys, remember this suture between the occipital bone. Let me take another pen. Yes, between the occipital bone and the parietal bone. This Y-shaped suture which you can see, guys, this is called as lambdoid suture. This is called as lambdoid suture. This is called as the lambdoid suture. So let us just try to make in our notes about every possible points that we are discussing in Norma Verticalis. Now guys, you can very well see what are the sutures between the bones. Suture between the bones. Please try to write the important aspects with us. Otherwise, it will be like, there's no point. You're watching it, but try to write it also. Yes. And the very first one that you already know, we have the coronal suture. Coronal suture. We have the sagittal suture. And we have the lambdoid suture. We have the lambdoid suture. Now guys, you already know the coronal suture. It is basically between frontal and two parietal bones. Two parietal bones. Yes, Korean queen. Yes. The sagittal suture, guys, you already know it is between. Yes. It runs in the median plane, guys, and you already know it is between two parietal bones. Two parietal bones, and the lambdoid one, it is between occipital and two parietal bones. Two parietal bones, right? So if you just want to see it over here, guys, yes. So this suture, it is the lambdoid suture, right? So I hope this is clear to each one of you. All the sutures are clear. Just give me a thumbs up in the chat box, guys, if all the sutures are clear. Right? If all the sutures are clear, just please try to give me a thumbs up in the chat box. Now, in the Norma Verticalis, we will try to learn some special features now. फटाफट से एक thumbs up दे दो chat box में if you guys are there listening to me, writing notes. Yeah. Maria, very good. Sure. Now, this is another, like, we are going to discuss some special features now. There is something called as the special features of the Norma Verticalis, and that is something which we have to study in detail. right? Yes. Beta, in Abhishek, in Norma Verticalis, the temporal part is not visible. Only four bones are visible, which you can see in the Norma. When you're watching the skull from above, you can see only frontal, parietal, two parietal, and one occipital. Okay, Abhishek. So I'm talking about the view, guys. Right now, this is again the now, guys. Just try to see over here. Whenever, guys. Okay, this is which suture, guys? You already know this is the coronal suture. This is the coronal suture. And this is which suture, guys? Yes, you already know this is the, okay, this is the sagittal suture. This is something you know, okay, between the two parietal bones, we have the sagittal suture, and between frontal and parietal bones, we have this, yes, the coronal suture. The meeting point, guys, very, very important. The meeting point of coronal and sagittal suture, it is called as bregma. This point, it is called as the bregma. Bregma. Meeting point of coronal and sagittal suture, it is called as bregma. Now, guys, just try to write about this. Yes, we have the very first one. Yes, that is the bregma. And you guys already know the bregma, it is the meeting point. Meeting point of coronal and sagittal suture. Meeting point of coronal and sagittal suture. Now, guys, this point again, guys, let us just try to see over here. Now, this is the skull of a newborn. Skull of a newborn. Okay, a fresh baby, guys, a fresh baby, a skull of a newborn. And guys, over here, if you just see, you can see the frontal bones, right? You can see the parietal bones. Now, this bregma, guys. Okay, now this bregma at birth, this area which is called as bregma in adult. Whenever it is a newborn, guys, you will see this particular area, right? A rhomboidal shaped area, and this is called as anterior fontanelle. This is called as anterior fontanelle. Now, guys, you already know this is the like the adult skull, right? Adult skull, and this is the skull of a newborn. But whenever a newborn is born, I mean, whenever a newborn is there, right? A baby will have, okay, these sutures are not getting fused. Okay, you cannot find any bregma over there. Over here, in this part, you will see a rhomboidal shaped space because it gives the space for brain, all the bones to grow. So that is something called as anterior fontanelle in a newborn, right? Anterior fontanelle basically ossifies at 11 month. Okay, it basically not exactly 11th, it's like 18 months, guys. It ossifies at 18 months, right? So yes, that is the anterior fontanelle, and just guys try to remember that yes, at birth, this area is occupied by a rhomboidal, yes, rhomboidal shaped membrane, called as anterior fontanelle. Yes, anterior fontanelle, which ossifies at age of 18 months. Which ossifies at age of 18 months, guys. So just give me a thumbs up, guys, if you understood what is bregma. Just give me a thumbs up in the chat box if you understood what is bregma over here. Okay, it is the meeting point of the coronal and the sagittal suture. And whenever a newborn is there, okay, So that area, it is basically occupied by a rhomboidal shaped membrane that is called as anterior fontanelle. At 18, it will fuse and it will give rise to this bregma. Right? Abhishek Shah, very good. Very good. What about rest, guys? Maria Rose, very good. Very good. I hope everyone is alive up till now. Yeah. Sure. Next feature, guys. Next feature, just try to see, guys, over here. We have something called as the vertex. Okay. Vertex. Now, it is the midpoint of the sagittal suture, guys. This is called as the vertex. Vertex. Very good. Shakil, very good. Yes. No, guys. No. Belima, vertex is the middle of the sagittal suture. You guys already know. This entire which I'm highlighting right now, it is the sagittal suture. And the midpoint of the sagittal suture, it is called as vertex. Right? It is called as vertex. So please just try to write it over here. The second one, that is the vertex. And remember, the vertex is nothing but the midpoint of sagittal suture. Midpoint of sagittal suture. The midpoint of sagittal suture. Right? The midpoint of sagittal suture. Now coming on to the third one, guys. The third one over here in a row. And that is called as lambda. Vertex. Abdikani Mohammed. Yes. Beta, vertex क्या होता है? ये देखो. Beta. Okay. Let me just try to show you over here. Abdikani Mohammed, you can see this suture, beta. It is called as the sagittal suture. It is called as the sagittal suture. And the midpoint of sagittal suture का ये जो बीच वाला जो part होता है, बिल्कुल midpoint इस sagittal suture का, इसको vertex बोलते हैं. Midpoint of sagittal suture, बीच वाला part, it is called as, yes, vertex. I hope it is clear, Adib Kani Mohammed. Yes. Now coming on to the next one, guys, that is the lambda. Now, lambda, it is basically the point of, okay, you guys are going to tell me it is the point of which two sutures. The lambda, it is point of which two sutures, guys? Yes. I don't have space over here. So lambda, I will be writing on this particular page only. That is the third part. Yes. Yes. Can anyone tell me it is the meeting point of which two sutures, guys? The lambda. Yes, the lambda. Huh. Guys, you can see this is the sagittal suture, right? The sagittal suture. And this is, yes. This is the lamboid suture. The lamboid suture, right? So meeting point of sagittal and lamboid suture. Yes, Osama, Shakil, Jesus, very good. Adib Kani, very good, very good. So lambda is nothing, guys. Remember, meeting point of, yes, meeting point of, yes, the meeting point of, or meeting point between sagittal and lamboid sutures. Sagittal and lamboid sutures. Meeting point between sagittal and lamboid sutures. Right? Now, guys, at birth, if I just try to see, yeah, at birth, you can see that this lambda, it is basically occupied by a triangle shaped membrane, giving space for all the bones to grow, right? Yes, and this one, remember, guys, over here, that is something called as the posterior fontanelle. एक anterior है, obviously this part is anterior and this is posterior. एक आगे की तरफ membrane है which is rhomboid shaped, and we have a membrane that is situated behind. That is called as the posterior fontanelle. Fontanelle, right? It ossifies at the age of 6 months, guys. It ossifies at the age of 6 months. Okay, so yes. So we are discussing lambda, guys, and we are discussing the special features. The special features, and you are We are discussing about lambda, and you know at birth it is occupied by a small triangular membrane. Small triangular membrane. And remember beta, this triangular membrane, it is called as, yes, the posterior fontanelle. Posterior fontanelle. And this posterior fontanelle ossifies at age of, yes, it ossifies at age of 6 months. 6 months. Very, very important. Very, very important. Right? We have very, very important. चलो इतना क्लियर है सब लोगों को? Is it clear everyone? Yes, just give me a thumbs up in the chat box if this is clear to each and everyone over here. Now guys, we have discussed 3 features. We have discussed bregma, vertex and lambda, right? The 3 features are done. Yes. Abhijeet, metopic suture, it is present in like 9% of the population only, and I will be teaching you the metopic suture also. No need to worry over here. Yes, I will be teaching you the metopic suture as well. Yes, but before that, the things which are like more prominent over here, let us just try to mark it over here. Guys, we will try to see, yes, we will try to see the most convex part of the frontal bone. Okay, these are called as, I mean, we have the most convex part. Okay, the frontal bone, and these are called as the frontal eminence. Frontal eminence. Now, what is eminence, beta? Eminence means the most convex part. Okay, सबसे उभरा हुआ part जो होता है, right? सबसे उभरा हुआ part. There will be a part in the frontal bone, entire frontal bone, that is more convex from outside. That is called as the frontal eminence. So the fourth one, guys, that you have to remember over here, we have 2 frontal eminence. 2 frontal eminence. And remember, eminence basically means the most convex parts of frontal bone. Most convex parts of frontal bone. Right? The most convex parts of frontal bone. In the parietal bone also, guys, in the parietal bone also, we will have these most convex parts, right? These are called as parietal eminence. These are called as parietal eminence. Right? So we have 2 parietal eminence as well. The 2 parietal eminence as well. And remember beta, it means the most convex parts of parietal bone. Most convex parts of parietal bone. The most convex parts of parietal bone. Apart from that, guys, just in the sides of the sagittal suture, you will see 2 foramina beta over here. Please try to appreciate. Yes, we have these 2 foraminas over here. The 2 openings over here. The 2 openings over here, which you can see over here. These are called as, these opening, जहाँ पे भी छेद दिखाई देता है, guys. If you can just notice, these are like openings, and these are called as parietal, or specially called as the parietal emissary foramen. Parietal emissary foramen. Now this parietal emissary foramen, it is on the sides of the sagittal suture, located more posteriorly. If you want, you can see this one over here, guys. There will be one over here as well. We have like 2 in number. We have 2 in number. I hope you can appreciate. These are the 2, yes, the 2 openings. दो छेद दिखाई देते हैं. These are called as the parietal emissary foramen. Okay, these are called as parietal emissary foramen. We have 2, or I can simply say parietal emissary foramen. And remember beta, these are present on each side of the sagittal suture. Okay, now guys, how to locate, guys, where are exactly these sutures? Remember, it is like 3 to 5 centimeter in front of this lamboid suture. These are 3 to 5 centimeter in front of the lamboid suture. पीछे lamboid suture है, उनसे 3 to 5 centimeter आगे आपको 2 openings मिलेंगी, 2 hole मिलेंगे. That is called as the, yes, the parietal emissary foramen. Usmangul, okay. Sarji from Pakistan. Okay, okay. Now, why this is called as parietal emissary foramen, guys? Because over here, a vein is passing, and that vein, guys, you already know, it transmits emissary vein. That's why it is named as parietal, because it is in the parietal bone. Emissary, why? Because it transmits emissary vein. Let me just write down. It is emissary veins. Now, emissary veins I will be discussing in detail, but as of remember, guys, it connects the scalp veins with superior sagittal sinus. So these veins will be passing through these holes, right? These veins will be passing through these holes. So that is the content of this parietal emissary foramen that you have to remember, right? So that is all about the Norma Verticalis, guys. That is all about Norma Verticalis. The important aspects that I have to discuss with you, right? So just give me a thumbs up, guys, that you have understood Norma Verticalis. Whatever bones are forming it, whatever sutures are present, whatever special features, whether it be brachma, anterior fontanelle, vertex, lambda, to frontal eminence, to parietal eminence, parietal emissary foramen, and the important vein which is passing through this, it is the emissary vein. Yes, love and respect from Afghanistan. Wali Nuri, thank you so much, beta. Abhishek Shah, Shakil, very good, beta. What about rest, beta? जल्दी से एक thumbs up दे दो अगर हो गया है तो. जल्दी से एक thumbs up दे दो अगर हो गया है तो. ओके, चलो चलो फटाफट से एक थम्स अप दे दो. पहले एक नॉर्मल व्यू ले लेते हैं सारे स्कल का, फिर एक एक बोन को डिस्कस करेंगे. नो नीड टू वरी बेटा. चलो ओसामा शेख. ओके ओके. चलो now I hope all the points are like clear and the birth of anterior fontanelle. Okay. Now, can anyone tell me in the chat box, guys, why anterior fontanelle and what is the purpose of anterior fontanelle and posterior fontanelle? I've told you the purpose, why it is like Jesus is Lord. Yes, okay. Now, coming on to the next one, that is the Norma Occipitalis. The Norma Occipitalis, guys. Again, we are going to discuss this in various aspects. So first, let us just try to understand. The very first thing that you have to remember, it is the posterior aspect of skull. Chalo, it is the posterior aspect of skull. It is the posterior aspect of skull. This is the posterior view. I hope you can appreciate this is the posterior view. It helps you during delivery of the baby. Yes, it gives the space for, yes. Shoaib Khan will explain, sir. Thank you, beta. Thank you so much. Yes. Very good. Jesus, very good. Chalo, you guys are like rocking, yaar. So, sab aata hai to. See, I'm starting from very basics. That is something I believe in, because if you deal everything from basics, guys, you will be like learning it from the scratch, from like beginning. So everything like in short, I'm not making writing thesis or something, but yeah, after this, if you read book, it will be like, yes, a piece of cake for you people, right? Now coming on to the Norma Occipitalis, it is the posterior aspect of the skull, right? Now you guys are going to tell me which bones are forming it. Yes, the bones forming it. Now guys, the bones forming it, you can very well see over here. We have the parietal bones. These are the two parietal bones. We have the occipital bone. And remember guys, this is the mastoid part of temporal bone. I'll be discussing temporal bone in detail, so no need to like yes. So it is the mastoid part of temporal bone. ये green वाली कौन सी bone थी? We have the temporal bone, right? which is just above the ears, right? So you have the temporal bone, right? So remember, now remember guys, the bones forming it, yes, you already know the names. Please try to mention it in the chat box, I mean in your notes as well. Yes, we have the parietal bones, that is again like 2 in number. The occipital bone, and we have like 2, I mean mastoid part of temporal bone, that is again 2 in number guys, that is again 2 in number. 2 in number, the mastoid part of the temporal bone, that is again 2 in number, right? Now this occipital part, this part which you can see bit over here, this part which you can see over here, this is called as the squamous part of the occipital bone. It is given a special name, that is called as the squamous part of the occipital bone. It is the squamous part. I will be discussing the different parts of the occipital bone, but as of now, remember, this is the squamous part of the occipital bone. This is the squamous part of the occipital bone. Occipital bone ही है, but ये कौन सा part है which you can see posteriorly? It is the squamous part of the occipital bone. Now guys, you already know the sutures. Can anyone tell me, yes, which suture is this? Which suture is this? Sutures between the bones. चलो फटाफट से बताओ. Yes, the sutures between the bones. Yes, it is the lamboid suture. Very good, Abhishek, Ankita, very good, beta. We have the lamboid suture. Again, I'm just writing in short. We have the lamboid suture, and guys, the second one, it is more important, guys. Yes. The more clear suture which you can see over here, it is between the, yes. If you can see the suture, guys, this is which part? This is the mastoid part of what bone? Temporal bone. And this is the occipital bone. This is the occipital bone. And this suture, guys, which I'm highlighting beta, it is called as, yes, occipitomastoid suture. It is called as, yes, this is called as the occipitomastoid suture. Now again makes the sense, guys, it is between the occipital bone and the mastoid part of temporal bone. So that's why the name occipitomastoid suture. Occipitomastoid suture. It is between occipital and mastoid temporal bones. Mastoid part of temporal bone. Occipitomastoid suture. Occipitomastoid suture. Now guys, over here, just try to see over here. Yes. We have one suture, guys. If you can just see over here. Yes. This suture, it is like between the, okay, let me just try to highlight this. I'm highlighting with this blue color and you are going to tell me the name. This suture, it is present between which two bones? Chalo, this blue colored suture, it is present between which two bones? Chalo, फटाफट से answer बताओ. Let us just try to answer this. Yes, it is present between, okay, one part I have written, the mastoid part of the temporal bone, and one bone it is. ठीक है, but yeah, the name of the bone, yes, parietal and temporal. Osama ठीक, Abhishek Shah, very good, correct answer. Yes, parietal-mastoid. Yes, parietal bone और mastoid part के बीच में. Parietal bone और mastoid part के बीच में है, right? So it is the parieto-mastoid suture. Parieto-mastoid suture. right? We have the parietal. Very good, Maria, Shakil, very good. Chalo, very good, guys. This is the parieto-mastoid suture. This is the parieto-mastoid suture. So yes, right now, guys, over here there are something like you have to remember. You can just mention over here in the notes as well. Chalo. In the notes also you can mention, yes, the parieto-mastoid suture. Parieto-mastoid suture. The parieto-mastoid suture. Yes, पेराइटो टेम्पोरल भी बोल सकते हैं, पेराइटोमेस्टॉइड भी बोलते हैं, because exactly it is the mastoid part of the temporal bone, right? Now over here, guys, just try to remember. Chalo, the special features, which is again a point of concern over here. Okay, I will be discussing the special features over here. The special features, right? The special features of Norma Occipitalis. Now, guys, let me just erase this so that I can just show you. Yes. I hope everything is like pretty clear to everyone. Yeah. Now, guys, just try to see over here. We have something called as, yes, the external occipital protuberance, right? We have something called as the external occipital protuberance, and in between we have the crest, right? So this is called as external, means bahar. Occipital means it is present on the occipital bone. Protuberance का मतलब होता है उभरा हुआ, a thing which is coming like outside, right? बोन का वो हिस्सा जो बाहर की तरफ थोड़ा सा निकला हुआ है, उसको क्या बोलते हैं? एक्सटर्नल ऑसिपिटल प्रोट्यूबरेंस, राइट? एक्सटर्नल ऑसिपिटल प्रोट्यूबरेंस, और ये बीच वाला पार्ट स्पेशली इट इज कॉल्ड एज द क्रेस्ट. It is called as the crest. Now, how to identify, guys, in a normal bone? Now, guys, if you know that we have a foramen in the occipital bone, can anyone tell me the name of the foramen that is present in the occipital bone? If I just try to show you, okay, let me just try to show you one picture. Can anyone identify this particular foramen beta over here? जिसमें से स्पाइनल कॉर्ड पास करती है. हम लोग स्कल को उल्टा करके देख रहे हैं. Yes, it is the Osama, very good. Ankita, very good. This is the foramen magnum. This is the foramen magnum. ये कौन सी बोन है? ऑसिपिटल बोन है. फोरामेन मैग्नम से लेकर, if we take a line from the foramen magnum, guys, and till the lambda, guys, foramen magnum से lambda अगर हम लोग लेते हैं, so basically this part beta, this is called as the external occipital protuberance. External occipital protuberance. Daily at 10 p.m. Rushali. Yes, Pradeep Raj, very good. Very good. बेटा ध्यान रखना कि ये जो सूचर है, which is called as the limboid suture. Limboid suture से if I try to draw a line and if I extend this line to foramen magnum, exactly in the mid of this line, इस लाइन का बिल्कुल मिड पॉइंट, यहीं पर आपको एक उभार देखने को मिलेगा, एक बाहर की तरफ पार्ट देखने को मिलेगा. That is called as external occipital protuberance. Please mention this in your notes. We have external occipital protuberance. External occipital protuberance. And remember, guys, it is this protuberance, this ubhar, it is basically, yes, this is basically between Sachidanand, very good. Why my writing pad is like hmm. Now it is, yeah, midway between, guys, remember it is midway between lambda and foramen magnum. फोरामेन मैग्नम सबसे बड़ा फोरामेन जो आपको देखने को मिल रहा है, थ्रू विच व्हाट इज पासिंग द स्पाइनल कॉर्ड, राइट, स्पाइनल कॉर्ड, राइट. नाउ गाइस रिमेंबर its center, if I just want to highlight this over here, exactly इसका जो center होता है guys, this center, exactly the center, it is called as the, yes, it is called as, yes, the inion guys, it is called as the inion, right? So exactly the center of this occipital protuberance, बीच वाला जो part होता है, that is called as the inion, right? So remember guys, it is, yeah, its center is called as inion. Its center, it is called as inion, right? Now remember guys, the upper part over here, the upper part beta of this protuberance basically will give rise to a muscle that is called as, yes, the trapezius muscle beta. Very, very, very important. The upper part, okay, the upper part of this protuberance, it is basically giving rise to a muscle that is called as the trapezius muscle. That is called as the trapezius muscle. Remember? So please remember one muscle that I have taught you over here, that the upper part gives origin to very important trapezius muscle. Which muscle? That is the trapezius muscle beta. That is the trapezius muscle, right? I will be coming to, yes. Now guys, the lower part of this, yes, the lower part basically gives rise to, yes, the lower part gives rise to a ligament that is called as the nuchal ligament. That is called as the nuchal ligament, guys, right? The lower part basically gives attachment to the upper part. Nuchal ligament is present like all below, right? Right? But over here, remember that the, yes, the upper part basically will be like giving rise to this nuchal ligament, right? So, yes. So remember, yes, I mean, the lower part gives attachment to nuchal ligament. Nuchal ligament, guys. The nuchal ligament. Right? So that is something you have to remember about the external occipital protuberance, right? लैम्बडा और फोरामेन मैग्नम का बिल्कुल जो मिड पॉइंट होता है, बिल्कुल ठीक है, आगे से अगर आप लाइन खींचोगे फोरामेन मैग्नम तक, जो बिल्कुल मिड वाला पॉइंट होगा, वहां आपको एक उभार देखने को मिलेगा, दैट इज कॉल्ड एज द एक्सटर्नल ऑसिपिटल प्रोट्यूबरेंस. मिड पॉइंट सेंटर को इनियन कहते हैं. इसका अपर वाला पार्ट ऑरिजिन देता है ट्रेपेजियस मसल को, और नीचे वाला पार्ट अटैचमेंट देगा न्यूचल लिगामेंट को, न्यूचल लिगामेंट को. ठीक है. नाउ गाइस, कमिंग ऑन टू द एक्सटर्नल ऑसिपिटल क्रेस्ट. Now, external occipital crest. External occipital crest. Now, guys, this crest. क्रेस्ट का मतलब मैंने आप लोग को बताया था. देखो, क्रेस्ट का मतलब क्या होता है. एक्सटर्नल मतलब समझ आता है बाहर, ऑसिपिटल मतलब समझ आता है इट इज द बोन, इट इज द बोन, occipital bone. What is crest? Now, guys, this is a line. Line becomes thick. It is a little thick. It is called as border. And if this border becomes more thick, guys, this is called as crest. क्रेस्ट का मतलब होता है थिकेंड बॉर्डर. क्रेस्ट मीन्स थिकेंड बॉर्डर. Crest means thickened border. Now guys, just try to see over here. ये जो पूरा का पूरा लाइन है गाइस, which is like extending below, ये बिल्कुल एक thick border की तरह होता है. This is called as the external. Yes, yes, it is the external occipital crest. External occipital crest. Right? So it extends from the external occipital protuberance above, right, to the posterior border. अब suppose ये foramen magnum है, foramen magnum का ये anterior वाला border हो गया और ये posterior वाला border हो गया. So ये external occipital protuberance से start होता है ये crest और कहाँ जाता है? Posterior border of foramen magnum पे. Posterior border of foramen magnum. Posterior border of foramen magnum. Right? If you just want to see beta over here. अच्छा चलो मुझे फटाफट से बता दो, ये फोरामेन मैग्नम है. फोरामेन मैग्नम का ये वाला पार्ट, ये कौन सा बॉर्डर होगा बताओ, ये कौन सा बॉर्डर होगा? ए. और ये वाला बताओ कौन सा बॉर्डर होगा? चलो बी. कौन सा बॉर्डर होगा? चलो आई एम वेटिंग फॉर योर आंसर्स एवरीवन. थोड़ा सा ओरिएंटेशन दिखाओ मुझे तो जरा कि एंटीरियर और पोस्टीरियर तुम्हें समझ में आया कि नहीं. हाँ चलो, मेडिसिन विद साहिल पोस्टीरियर है ए. ऑब्वियस सी बात है बेटा, तीत आगे दिख रहे, दांत तो आगे ही होता है ना, तो ये एंटीरियर व्यू हो गया, मतलब ये पोस्टीरियर हो गया. तो ये वाला जो हो जाएगा वो पोस्टीरियर बॉर्डर है और ये वाला क्या हो जाएगा? दिस इज द पोस्टीरियर बॉर्डर और ये आगे वाला एंटीरियर. तो पोस्टीरियर बॉर्डर तक वो जो लाइन है, वो जो क्रेस्ट है, उसको क्या बोलते हैं? एक्सटर्नल ऑसिपिटल क्रेस्ट. राइट, इट इज कॉल्ड एज द एक्सटर्नल ऑसिपिटल क्रेस्ट. चलो वेरी गुड अंकिता, शकील, ओसामा, मनगंडा, वेरी गुड बेटा, वेरी गुड. So remember guys over here that this occipital crest, right? So this is the one which is like, yeah, extends from external occipital protuberance, external occipital protuberance, okay, and remember to posterior border of foramen magnum, to posterior border of foramen magnum. Remember guys, one more attachment over here on this crest, basically the nuchal ligament is attached, and especially the base of the nuchal ligament is attached. It gives attachment to base of nuchal ligament. Base of the nuchal ligament. It gives attachment to the base of the nuchal ligament. Right? It gives attachment. Pura nuchal ligament pura extend karta hai beta. Right? Now guys, we have three lines over here that I wanted to tell you. That I just wanted to tell you guys. Yes. Now guys, just try to look at this picture over here. Okay. Now we have something called as the superior nuchal line. Now when I say line guys, line को हम लोग ridge भी बोलते हैं anatomy में. We call it as ridge also. Line it is also called as the ridge. Line it is also called as ridge. So we have a superior nuchal line. Remember guys, this superior nuchal line, it is extending from the external, yes, occipital protuberance, right? Yes, it is extending from the external occipital protuberance. This line guys, which is extending both the ways, this is called as the superior nuchal line. It is called as superior nuchal line. Remember, below this guys, yes, below the superior nuchal line guys, remember we have this, yes, these lines These are called as the inferior nuchal line. These are called as the inferior nuchal line. And just 1 centimeter above, a faint line is present. A very, very faint ridge is present. And this is called as the highest nuchal line. This is called as the highest nuchal line. This is called as the highest nuchal line. This is called as the highest nuchal line, guys. This is called as the highest nuchal line. Just external protuberance, say we have starting of the superior nuchal line, below inferior, and just 1 centimeter above, we see a very faint line, and that is called as the highest nuchal line. Highest nuchal line. So yes. So I hope this is clear. So you can see the superior nuchal line. It is starting from the external occipital protuberance and it is going towards the mastoid part, the mastoid process, right? So remember, guys, let us just try to write this. All the 3 lines, they are very, very, very important, and all the muscle attachments are like very, very important. So remember, guys, we have, yes, the superior nuchal line. The superior nuchal line. Yes. We have the, okay, the inferior nuchal line. The inferior nuchal line, and above superior we have the highest nuchal line. Highest nuchal line, right? We have these 3 nuchal lines, which are again very, very, very important. Now guys, if you just want to draw, you can just like draw, right? One going from here to here. This is the superior nuchal line, right? Below this, yes, we have the inferior nuchal line, right? This is, and just 1 centimeter above, a faint line is there. This is called as the highest nuchal line. Highest nuchal line. Highest nuchal line. Right? Highest nuchal line. Now guys, just remember over here, guys, in the superior nuchal line, the medial 1/3. The medial 1/3 will give origin, along with the occipital protuberance, will give origin to trapezius muscle. The medial 1/3 of the superior nuchal line will give attachment, the origin to which muscle? Trapezius muscle. The lateral 1/3 of the superior nuchal line will give, will give insertion to one muscle, and that is called as, okay, the sternocleidomastoid muscle. The sternocleidomastoid muscle. Very, very, very important. The sternocleidomastoid muscle. Now guys, even if you just try to see this muscle, which I'm just pinching on my neck right now, this is called as the sternocleidomastoid muscle. Okay, so superior nuchal line, remember guys, yes, I'm talking only about the attachments. The medial 1/3 will give origin to, yes, trapezius muscle. Trapezius muscle, and that is the origin. And lateral 1/3, it gives attachment to sternocleidomastoid muscle. Sternocleidomastoid muscle, and that is again insertion, guys. This is insertion. This is insertion, right? This is insertion. Main things you have to like remember. Inferior nuchal line, guys. Okay. So inferior has nothing, guys. Inferior, it is between the superior nuchal line. Okay, and you already know. Yes, so it is like middle of the occipital crest, right? So we have the inferior nuchal line. As such, no attachment is there over here, so no need to worry about this, right? Highest nuchal line, again it is a point of concern over here. The highest nuchal line, okay, the highest nuchal line will be giving attachment to, okay, the medial part, and the lateral part. The medial part basically gives attachment to epicranial aponeurosis. I will be discussing this in detail. No need to worry, I will be discussing this in detail. It is called as the epicranial aponeurosis. Epicranial aponeurosis. And remember, the lateral part gives origin to occipital belly of occipitofrontalis muscle. Occipitofrontalis muscle. Occipital belly of occipitofrontalis muscle, and this is the origin beta. As of now, just try to remember the name. I will be discussing each muscle in detail. But as of now, just try to remember the name. It is the occipital belly of occipitofrontalis muscle. Occipital belly of occipitofrontalis muscle. Right? So, if you can see the highest neutral line, guys, you can see this part. This part will be giving rise to, yes, you already know external cranial aponeurosis, right? It is the external, or the, I can simply say the epicranial aponeurosis. Epicranial aponeurosis, right? And the lateral part will be giving origin, yes, to occipital belly of, right? It is the occipital belly of occipitofrontalis muscle. Occipitofrontalis muscle. Occipital belly of the occipitofrontalis muscle. So that is about the three neutral lines. The inferior one not necessarily important, superior one and the highest one. How to recognize the highest neutral line? It is just 1 centimeter above the superior neutral line. Superior neutral line you can recognize like clearly, and just 1 centimeter above we have the highest neutral line, right? Now, yes, there is one foramen, guys, over here, right? There is one foramen, one more foramen that you have to like remember, guys, in the mastoid part, that is called as the mastoid emissary foramen. We have a foramen over here. Yes, that is called as the mastoid emissary foramen, right? So this mastoid emissary foramen basically gives passage to the emissary vein. Okay, mastoid emissary foramen, right? We have a foramen over here, that is the mastoid emissary foramen giving passage to the emissary vein. So just give me a thumbs up, guys, if Norma occipitalis is also done. The Norma occipitalis is also done. The bones, the sutures you already know, and the special features, the external occipital protuberance, the crest, the neutral lines, right, the inion, these things, and the muscle attachments. Yes, Abhishek Shah, very good beta. Sahil, very good beta. What about rest? चलो बाकी भी रिप्लाई दे दो फटाफट से. What about rest? Are others alive? चलो. Actually, I'm working in hospital as well, Vishali. Otherwise, I would love to take the class in the morning. Shakir, very good. But just Vishali, if you can like adjust, because live classes are more interactive and like you will try to learn a more. Now coming on to Norma Frontalis, coming on to the Norma Frontalis, and we are just going to discuss it like, yes, yes, it is the anterior aspect of the skull. Remember, guys, it is the anterior aspect of skull. It is the anterior aspect of the skull, right? Now, guys, what are the bones that are forming it? What are the bones that are forming it? Now, guys, which bones you can see? Can you identify this bone? That is the frontal bone. That is the frontal bone, guys, right? So remember, we have the frontal bone. Yes, we have the frontal bone. The second one, guys, the second one, you can very well see the zygomatic bones, right? These are the zygomatic bones. The squamous part of the frontal bone. Yes, yes, right, Peter. The zygomatic bone. How many zygomatic bones are there? Remember, they are two in number. We have this zygomatic bone also. So these are two in number, right? The third one, guys, remember the major bones I'm talking about. These are the maxillary bones. The two maxillary bones. Maxillary bones, again, they are two in number, right? Now, uniting to form the upper jaw, maxillary bones will form the upper jaw. And the major bones like below, yes, it is the mandible. It is the mandible. Mandible is like only one over here, right? The mandible, right? So we have the mandible. Mandible is only one, and you already know it forms the lower jaw. It forms the lower jaw. It forms the lower jaw, right? So that is something you have to remember. The major bones we are talking about, Sahil over here. Yes. Now, guys, if I just want to highlight the parts of these, now the parts of these bones, guys. Now, remember, guys, they are basically okay. Before the parts, let us first discuss the sutures. Okay, the sutures between the bones. Sutures between the bones. Now, I think Sahil, you were the one. You were like telling me, ki sir, frontal bone. It is okay. We have one suture in between the frontal bone, guys, and that is yes. In between the frontal bone, it is not visible over here, guys. Again, telling you the suture. It is called as metopic suture. It is called as the metopic suture. The first one, we have the metopic suture. Again, guys, this suture, it is visible. I mean, it is between the two halves of the frontal bone. Let us just write down. It is between two halves of frontal bone. Two halves of the frontal bone, and just remember it is present in 9% of the population only. That's why I've not mentioned at that time. It is present in 9% of population, 8 to 9% of population only. That is, it is between the two halves, and this suture, like over here in this image, it is not visible as well, right? So it is the yes. Now the second one, guys, the frontonasal suture. The frontonasal suture, and you guys, yes, Sony thalamus was left. I'll just try to like revise it later. Okay, the frontonasal suture, guys, can you tell me it is present between which two bones? Anyone in the chat box who would like to address, it is present between which two bones? The frontonasal suture. Now, guys, you can very well see this is the nasal bone, this is the nasal bone. It is present between the frontal bone and the nasal bone. Yes, medicine with Sahil. This is the frontonasal suture. Frontonasal suture. It will be present like both the sides. Frontonasal suture, I even don't need to write it. Now, can you tell me, guys, over here, if you just try to clearly see this suture, it is present between which two bones? Can you tell me the name of this suture? It is present between which two bones? Yes. You can see the maxilla beta. You can see the maxilla going up and frontal bone going down. It is called as frontomaxillary suture. It is called as the frontomaxillary suture. Yes, yes, very good. Nay, Munganda, it is the maxillary bone, right? It is the maxillary bone, right? So हाँ बेटा देखो maxillary ऊपर तक जा रहा है ना. If you just try to see over here, please focus. I'm not focusing on the maxillary nasal suture. I'm talking about this suture. Okay, this suture on both the sides between maxilla and frontal bone above. Frontal bone above and below we have maxilla. It is the frontomaxillary suture. The third one, guys, that you have to remember, it is the frontomaxillary suture. the frontomaxillary suture. Now, I would request everyone to answer this, guys. Okay, this particular suture, can anyone tell me what is the name of this suture, guys? Or even you can tell me which bones are forming this suture. If anyone can tell me which bones are like forming this suture. चलो फटाफट से बताओ. चलो. Yes, medicine with Sahil, very good. Zygomatico maxillary, okay, very good. बेटा देखो zygomatic bone है और ये maxillary है, तो ये suture जो होगा that is zygomatico maxillary suture. Very good, Sahil, very good. So the fourth one that you have to remember in the row, it is zygomatico maxillary suture. Zygomatico maxillary suture, right? Now, in between the maxillary bone, this suture, can anyone tell me the name of this suture, guys? This is zygomatico maxillary suture. हाँ चलो बताओ फटाफट से क्या होगा इसका आंसर. बताओ, दो मैक्सिलरी के बीच में, between the two maxillary bones. Yes, we have the intermaxillary suture. Yes, Abhishek Shah, very good. Munganda, very good. बेटा ये वाला देखो, बीच वाला क्या हो जाएगा, दो मैक्सिलरी बोन्स के बीच में, एनीथिंग व्हिच इज लाइक इन बिटवीन द टू, इट इज कॉल्ड एज intermaxillary suture. Intermaxillary suture. It is called as the intermaxillary suture, right? It is called as the intermaxillary suture, right? We have like more sutures, guys, but as of now, the okay. If you just want to see, guys, in between the nasal bones, we have internasal suture. Internasal suture in between the nasal bones. If you can just clearly see, guys. Yes, if I'm just trying to make it like in between the nasal bones. This is the internasal suture. Internasal suture. This between the zygomatic bone and the frontal bone. Yes, zygomatico frontal suture. Yes, it is the zygomatico frontal suture. Zygomatico frontal suture. Right? So that is something you guys have to remember. Okay? Sure. सारे sutures clear हो गए सब लोगों को. Just give me a thumbs up in the chat box, guys, if the bones are clear, if the sutures are clear. All the sutures in the frontal aspect, they are clear to you. Just give me a thumbs up in the chat box if in the Norma Frontalis the bones are clear, the sutures are clear. Right? Chalo, medicine with Sahil, very good. Very good. Yes. What about rest, guys? Are you all alive? Now, guys, if we talk about the parts, if we talk about the parts of Norma Frontalis, we have basically beta three parts. Please write down that it is the upper part, which is the forehead, the middle part, which is composed of cavities, right? Which is composed of cavities, right? We have the two orbital cavities. I mean, you can see the orbits. We have two orbital cavities. Which are the major ones? Orbital cavities. Yes, and one which is below, which you can see the nasal cavity. This is the nasal cavity. One nasal cavity. Two orbits in which the eyeballs are there, and which we have the nasal cavity, right? The nasal cavity. And the lower part, which is like formed by the upper jaw, that is the maxilla, and lower jaw, which is mandible, lower jaw, which is mandible. So the parts of Norma Frontalis are nothing but the upper part, that is the forehead. Then we have the middle part that is having the cavities, the two orbital and one nasal, and lower part which is having the jaws. The upper jaw formed from the maxilla and the lower jaw which is the mandible. The lower jaw which is the mandible, right? So these are the basic three parts that you have to know in Norma Frontalis. Now guys, coming on to the special features. Coming on to the special features, right? We are now going to discuss about the special features over here. I hope till now, whatever we have discussed, guys, it is clear to every one of you. Just give me a thumbs up. Another 10-15 minutes we'll be discussing the special features and then I will leave you. Just give me a thumbs up, guys. Medicine with Sahil, Abhishek Shah, very good. Chalo, I'm waiting for your thumbs up, everyone. Please let me know. Yeah, if you are alive. Now, guys, we have something called as the frontal eminence. We have something called as Shakil Ahmed. Very good, very good. What about rest, guys? Are you all alive? We have parietal eminence. We have already discussed the parietal eminence, the most convex part, right? Over here also, we have the frontal eminence. Frontal eminence. And remember, they are the most prominent areas. Okay, most prominent areas. Yes, Sarah Akil, I will be starting daily at 9 or 10 p.m. So remember, beta, the frontal eminence, it is the most prominent areas. On either side of forehead. No need to write like so much. Coming on to the next one. Guys, that is the superciliary arches. Coming on to the next one. Yes, we have something called as the superciliary arches. These arches, guys, these are called as the superciliary arches. Arch का मतलब क्या होता है? It is just like this, guys. Can you see these superciliary arches? Right, the superciliary arches. Yes. Now these superciliary arches are elevated lines, guys. Especially I will say it lines because they are just like line or ridge. Ridge or line का मतलब एक ही होता है. Please try to remember, guys. Ridge and line means the same thing. So we have superciliary arches, and remember these are elevated arched ridges. Arch बना रही है ना, arch ऐसा ही होता है, arched ridges, right, just above the medial parts of the superior orbital margin. Like these are like arched ridges are more prominent in males. These are more prominent in males, right? Now guys, this medial part, okay, between the two superior ciliary arch, okay, the median elevation between the two superior ciliary arch, it is called as the glabella. This part between the two superciliary arch, it is called as the glabella. Okay, Rushali, कोई बात नहीं बेटा, बाद में देख लेना. Video will be there on YouTube, guys. If anyone feeling tired, please make yourself relax. No need to like I won't delete the video, and I hope the team also won't delete it. So please don't worry about this. Join my Telegram group, that is Docsmayan. If anyone is leaving, you can like have access to the notes over there. I will be like uploading it after the class. Okay. We have glabella. It is median elevation. Okay, it is a median elevation between two superciliary arches, and it is just above the root of the nose, right? So that is the glabella, guys, right? So median elevation median elevation between the two superciliary arch. Two superciliary arch, right? And it is just above the root of the nose. Now, guys, you can very well see over here. If you can just tell me which suture is this? If you can just tell me which suture is this which I have pointed right now. And guys, if you can just tell me one more suture that I'm pointing it right now. Which suture is this? Yes. ठीक है, मेडिसिन विद साहिल दो नेजल बोन्स के बीच में है तो ये इंटरनेजल सूचर हो गया. वी हैव द इंटरनेजल सूचर, राइट. और ये ऊपर फ्रंटल बोन है, फ्रंटल और नेजल के बीच में हो गया. ठीक है, फ्रंटल और नेजल के बीच में हो गया तो फ्रंटोनेजल सूचर हो गया, फ्रंटोनेजल सूचर, right? So these two sutures you guys already know. Yes, Shakil, Abhishek, yes, very good guys. Now guys, just try to see over here. Okay, just try to see over here the meeting point, guys. The meeting point of frontonasal suture, right? The frontonasal and internasal suture. ऊपर से frontonasal और बीच से nasal suture. This meeting point, guys. This is something which is called as nasion. ऊपर से frontonasal और ये जो internasal suture है, that is something called as the nasion, guys, right? So remember, point of meeting between, remember, yes, point of meeting of लिख लो, better रहेगा, of two, yes, of frontonasal and internasal suture. Frontonasal and internasal suture. Frontonasal and internasal suture. Right? Frontonasal and internasal suture. Right? Now, coming on to one of the notch or foramen, guys. Over here, please just try to see over here in this particular side. There is a notch, guys, over here, which you can see, which you can appreciate over here. This notch, this U-shaped notch. Okay, I'm just trying to delete the other ones, the sutures you already know. Now this notch, that is called as the superciliary notch, or it is also called as foramen. Okay, it is the superciliary notch. It will be present both sides, please, superciliary notch or foramen. So the fifth one, the superciliary notch, or it is also called as the superciliary foramen. The superciliary foramen. And remember, guys, through this foramen, now guys, remember, let us just try to see where exactly this is present. I am, please, sorry, I'm like pointing out this nasion over here, and superior ciliary arch, you already know. Yes, the superior ciliary arch. Now guys, this notch, it is present just in between the medial 1/3, right? It is just between the medial 1/3 and lateral 2/3. Lateral side से 2/3, medial side से 1/3, और उसके बीच में ये नोच देखने को मिलती है. Okay, it is present at medial 1/3 from the midline 1/3 and lateral 2/3. ये नोच बिल्कुल exactly यहीं पे मिलेगी. ठीक है? So that is like medial 1/3 and lateral 2/3. And remember, guys, from this notch, what is so special that is passing? Yes, you should know, guys, we have the supraorbital nerve, supraorbital artery, supraorbital vein. So all this basically it is passing through this notch. We have the vein, artery, and the nerve. The vein, artery, and the nerve. Yes. Superciliary notch or foramen. Yes. So remember, guys, basically what is passing through this foramen? We have, yes, the superciliary vessels. Now, when I say vessels, guys, I'm talking about the arteries and the veins and the superciliary nerve. Right? We have the superciliary nerve as well. Right? Yes, superciliary nerve. Superciliary nerve. Yet vlog for nation. Hello, Dr. Abhijeet. Hi, hi, hi. Who are you? Come with your real name. Shall. Now, guys, coming on to the next one, you have the nasal bones, right? I think I even don't need to tell you. Yes, the nasal bones are there. The two nasal bones, right? Basically, they form the bridge of the nose, right? So, okay, the nasal bones basically they articulate with the frontal bone above, and on the sides we have the maxilla bone. On the sides we have the maxilla bone, and in middle we have the internasal suture. In between the nasal and maxilla, okay, nasomaxillary suture, and between the frontal and the nasal bone, frontonasal suture. These all sutures I have already discussed with you, Dr. Prakash. Okay, I don't. Yeah. So that is something you guys already know. Okay. So yes, this opening, guys, which you can see over here, this opening which you can see over here, that is actually called as the nasal aperture. That is called as the pyriform aperture. बिल्कुल like pear shaped है, so that is called as the pyriform aperture. Okay, pyriform aperture, and guys, basically the lower part of the nasal bones, if you can just clearly see, the lower margins of the nasal bone, basically they are the ones which are forming the upper part of the pyriform aperture. ये जो फोरामिन आप लोग को देखने को मिल रहा है, नेसल अपर्चर देखने को मिल रहा है, इसका जो अपर पार्ट है वो कौन बना रहा है? हमारा नेसल बोन्स. वो कौन बना रहा है? इट इज nasal bones. Abukar Ahmad, greeting to you, Dr. Abhijeet from Somali. Okay, Abukar, hello, hello, hello. Yeah, like I'm the most savage doctor. So yeah, I have been given this name. I've done a reality show. I mean, as a doctor on set, the Splitsvilla 15, Splitsvilla 14, and I have been given the name by the crew and the contestants over there only, the savage doctor. So I'm being the most savage one. So yes, I've been a doctor in reality shows as well. So that's why. So I always say love from the savage doctor, and that's actually me. So yeah. Now guys, coming on to the zygomatic bones over here. Coming on to the zygomatic bones. So nasal bones में इतना ही अभी पढ़ना है. फिर आ जाते हैं zygomatic bones पे. The zygomatic bones. Okay, we don't have over here. Okay. Now, coming on to the zygomatic bones. Asif Lahori, hi beta. Zygomatic bones. Now the zygomatic bones has like four process. Now what is beta actually meant by the term process? Now when I say process, guys, process means when I say process simply means that part of the bone which is coming out. For example, you have your own body and your part of the upper limb, it is coming out, right? It is the part of the body only, the upper limb. Similarly, in bones, beta, we have the body of the bone, and there are certain parts of the bone which are extended or which are coming out. This is something which is called as process. This is something which is called as the process, beta, right? So in the zygomatic bones, remember we have like four processes. 4 processes, and I even don't need to tell you guys because you are very well aware of these 4 processes of the zygomatic bone. Just clearly try to see over here, guys. Just clearly try to see over here. This zygomatic bone, one part of the zygomatic bone, it is going towards which bone? Can anyone tell me in the chat box? This part of the zygomatic bone, it is going towards which bone? Again, the name will be based on that part only. This is the part of zygomatic bone. It is going towards which bone, guys? Yes, it is going towards which bone? Anyone in the chat box? Yes, Abukar Ahmad, very good. It is going towards the frontal bone. It is going towards the frontal bone. So remember, yes, beta, we have the frontal process of zygomatic bone. This is called as the frontal process of zygomatic bone. So we have frontal process of zygomatic bone. The frontal process of the zygomatic bone. The frontal process of the zygomatic bone. Now, one process, guys, it is going behind towards the temporal bone. If you just want to see in the lateral view, it will be more clear. So I will just take you to one of the views over here. Yes. If you can see, guys, this process, this is zygomatic only. And this is the process which is going towards which bone? That is the temporal bone. Now, this is called as the temporal process of this zygomatic bone. Okay, it is called as the temporal process. It is articulating with which bone? Temporal. This is the frontal process. This is the frontal bone, right? And this is, yes, the zygomatic, which part? The frontal process of the zygomatic bone, right? So please just try to mention it in your notes as well. We have the temporal process of zygomatic bone, which is going towards the temporal bone only. It is the temporal process of the zygomatic bone, right? Yes. Now, guys, one which is coming towards the maxilla, guys, it is called as the maxillary process. The one which is going towards the maxilla, it is called as the maxillary process of zygomatic bone, right? It is called as maxillary process of zygomatic bone. It is called as the maxillary process of zygomatic bone. The maxillary process of the zygomatic bone. And we have one more, guys. We have one more. Okay, that is forming the orbital plate above, right? The orbital plate above, right? This is the, yes. So we have one process, yes, that is the orbital plate, which you have to remember. Now, this orbital plate, it is basically sharing in front of the lateral wall. You can see this is the lateral wall of the orbit, this side one. Beach wala medial hoga, the side one, it is the lateral wall of the orbit, and the floor of the orbital cavity, right? It's forming the lateral wall on the floor. So that is the orbital plate, which you can see over here, right? चलो इतना क्लियर है सब लोगों को. Just give me a thumbs up in the chat box if this is clear to everyone over here. Chal, Shakil, very good beta, very good. Abhishek Shah, very good. Now one more thing, guys, I want to say over here. It's not actually mentioned over here. There is no foramen which is shown over here in the zygomatic part. So there again, beta, is a foramen, and that is called as the zygomaticofacial foramen. Okay, we have zygomaticofacial foramen. Now we have zygomaticofacial nerves and vessels, zygomaticofacial artery, zygomaticofacial vein, and the zygomaticofacial nerve passing through this foramen, which is located in the, yes, the zygomatic bone over here. The zygomatic bone over here. Is it done, everyone? Yes, just give me a thumbs up if it is done. Yeah. Again, guys, one important part that I have to discuss over here. Yeah, the next it is the, yes, the maxillary bones. So yes, maxillary bones. Let us just try to like discuss tomorrow regarding the maxilla. Okay. Let us just try to discuss. I will be telling you in short about the maxilla, or you can just mention it over here as well. Because individually, anyways, I'm gonna discuss every bones, right? So you already know we have the two maxillary bones. Just for the sake of completion of this topic, you should know better. We have the two maxillary bones, right? They articulate together in the front, forming the intermaxillary suture, right? Now, right? So basically, the maxillary bone has a body. Okay, it is containing maxillary air sinus. It is containing the maxillary air sinus. Maxillary air sinus. Yes, it's beneficial for both, beta. It's beneficial for both. Even the prof exams also and NEET PG, like if you have no basics, please just try to look at that, right? Yes. We have the frontal process. Now, when I say frontal process, guys, this frontal process articulates with the frontal bone, right? It articulates with the frontal bone above, okay? Then we have the nasal bones on the lateral side, right? Yes, on the medial side, sorry. And on the lateral side, we have the zygomatic bone, right? Now, apart from that, guys, remember the anterior surface. Okay, I will be discussing this again, guys. No need to worry. Just remember, guys, the anterior surface. It has various parts. We have the nasal notch, right? We have anterior nasal spine, canine eminence, canine fossa, incisors. All those teeth wala structure will be over here, right? We have alveolar process. Absolutely no need to worry if you don't understand this right now. I will be discussing this bone in detail. And along with that, remember we have the zygomatic process. Zygomatic process. Because again, I have to explain this, guys. I will be like more focusing when I will be discussing the osteology of the maxilla. Osteology of the maxilla in detail, right? So as of now, just mention it over here. I will be discussing the osteology of the maxilla and mandible in detail because these are very important bones, right? Maxilla and mandible in detail, right? So important points you already know, all the sutures you know, all the special features which we have talked about, and the various parts in the fronta, norma frontalis, right? We have discussed norma occipitalis in detail. We have discussed about the norma verticalis and different aspects of the skull and all the bones that are present in the skull. So I hope, guys, you all enjoyed. We will be discussing each bone in detail, so no need to worry. We are just discussing the different aspects, and we are just discussing the different, I mean, the important. So once again, when we discuss again, you are at least aware of the some parts, right? So just give me a thumbs up, guys, if you enjoyed today's lecture. Yeah. चलो एक thumbs up दे दो जल्दी से chat box में that you enjoyed, and for the notes, guys, you please Telegram group, that is Docs Mayan. And for doubts, guys, you can text me on my Insta ID. That is, yes, Abhijeet Kumar 7859. Very good. Muganta Vinay, Shoaib, Abhishek, Akhilesh, Osama, Rohit, Shakil. Yes, Suman, very good. Abhijeet Kumar 7859. Right? Insta ID for the doubts, Telegram for the notes. Right? So let us meet tomorrow at 9 or 10. Right? So we'll be again meeting at 9 or 10 p.m. I'll let you know, guys, and we'll be discussing the other aspects of the skull tomorrow. Right? So don't worry, very difficult topic, but I will try to make it easier for you. Okay? Maxilla mandible, again, I will be discussing it in osteology. So even if you just know the names, it's okay for me, and the sutures. Okay, sure. Bye.